The webcast is now started now, Chair.
Okay, thank you. Welcome everybody to the January meeting of Scrutiny Board for Adult Health and Active Lifestyles. You're all very, very welcome, and just some housekeeping messages. Can all participants are requested to mute their microphones unless they are speaking. The preferred approach is for members to have their video streams switched on when speaking, please. A red live symbol is at the top left-hand corner of your screen now that we're webcasting live. Participants should use the raised hand button to indicate they wish to speak, and I will endeavour to keep an eye on who's got their hand raised. If you experience technical difficulties, please notify myself or Angela Brogden, and I'll use the chat or inform ourselves in another way. And if I'm experiencing technical difficulties, I will, in first instance, I'll try to re-establish connection. If this fails with the agreement of the board, can we nominate Councillor Trustwell to take over if there's a technical problem? So I'll take silence as agreeing to that. Thank you. Can I also at this point give my huge thanks to Councillor Trustwell for stepping in and chairing this scrutiny board in November. I really, really appreciate it, and I know that you did a fantastic job. So I just want to say that thanks publicly. So we'll go on to welcomes, and can I welcome the following board members? If you could introduce yourself, please, and we'll start with Councillor Anderson.
Good afternoon, I'm Councillor Caroline Anderson. I represent the Adel and Wharfedale ward.
Thank you. Dr. Beale.
I'm John Beale. I chair Health Watch Leeds, and I'm a co-opted member of this board.
Thank you. Councillor Elliott.
Councillor Judith Elliott, Molly South.
Councillor Harrington.
Good afternoon, Norma Harrington, Wetherby Ward Councillor.
Councillor Iqbal.
Mohammed Iqbal, Councillor for Hunslet and Riverside Ward.
Thank you. Councillor Knight.
Good afternoon, Councillor Christine Knight, Wheatwood Ward.
Thank you very much. Councillor Lay.
There we go. Good afternoon, everybody. Councillor Sandy Lay, Otley and Yeadon Ward.
Thank you. Councillor Reagan.
Are you going to type that up, Katie? Are you all
I
right
think
with
somebody's
that?
not on mute.
Yeah, I'll type that up.
Good afternoon, Councillor Denise Reagan from Bermondsey, Richmond Hill Ward.
Thank you. Councillor Smart.
Well, I'm going to
Hi everyone, Councillor Alice Smart, Armley Ward.
Thank you very much, Councillor Smart. Sorry, there's somebody, I can hear somebody else. Could we all make sure that we're on mute, please, if we're not speaking? Thank you very much. Sorry, Councillor Smart, you're very welcome this afternoon. Councillor Trustwell.
Thank you, Chair. Councillor Paul Trustwell, I represent Middleton and Belle Isle.
And finally, but not least, Councillor Wenham.
Good afternoon, Councillor Angela Wenham. I represent the Wronghay Ward.
Thank you very much. So we'll go on to the agenda, and can I invite...
Councillor Latty's here as well.
Oh, yes, sorry, I did call your name. Yes, you did. Sorry, Councillor Latty. Did I not call your name? Oh, no. Sorry, I think it was all the confusion. I went straight on to Councillor Lay, didn't I? I do apologise, Councillor Latty.
Good afternoon. Graham Latty, representing Guiseley and Rawdon Ward.
Thank you very much. I do apologise about that, sorry.
No problem.
Can I also invite Angela Brogden to introduce herself, please?
Good afternoon, Angela Brogden, Principal Scrutiny Advisor.
Thank you. And can I invite Harriet Spate to introduce herself and to go through the first 5 items, please?
Yes, thank you, Chair. Harriet Spate, Governance Officer. So onto the agenda, and item number 1, appeals. There are no appeals, Chair. Under item number 2, there are no exclusions of the public today. Under item number 3, there are no late items. Under item number 4, can I invite board members to declare any disposable pecuniary interest, please? And I'll take silence as none. Okay, thank you. And under agenda item number 5, Chair, we've had no apologies for today's meeting and everyone is in attendance. Thank you.
Thank you very much. That's fantastic. Thank you. So item number 6, minutes of the meeting of the 24th of November 2020. As I said, Councillor Trustwell was chairing this meeting. Can I take them approved of the correct record of the meeting held on the 24th of November? I'll take silence.
Yes, Chair. Chair.
Thank you very much, Denise. Thank you. And any matters arising from those minutes? Thank you very much. Okay, so we'll go on to item number 7, the performance update for adult social care, public health and active lifestyles. So the purpose of this item is to consider the joint report from the Director of Adults and Health and the Director of City Development, which presents an overview of outcomes and service performance related to the council priorities and services within the Scrutiny Board's remit. So can I invite participants to formally introduce themselves at this point? So can I invite Councillor Charwood and Councillor Rafiq to give an initial introduction as well. So if I start with Kath Roth, could you introduce yourself, please? And be very welcome.
Good afternoon. I'm Kath Roth, Director of Adults and Health.
Thank you. Victoria Eaton.
Good afternoon. I'm Victoria Eaton. I'm the Director of Public Health at Leeds City Council.
Thank you very much. Shona McFarlane.
I am Shona McFarlane. I'm the Deputy Director for Adults and Health.
Thank you very much. Steve Hume.
Hi, I'm Steve Hume. I'm Chief Officer Resources for Adults and Health.
Thank you. Anna Freyson. Oh, I don't know when. Can we hear Anna? Did anybody else not hear Anna? No, I think there's something wrong with the sound, Anna, there. But we'll hopefully get that sorted. Phil Evans, please.
Afternoon, members. I'm Phil Evans. I'm the Chief Officer Operations in City Development with responsibility for active Leeds.
Thank you. Steve Baker, please.
Afternoon, everyone. I'm Stephen Baker. I'm the Business Manager for Active Leeds.
Thank you. And Peter Story, please.
Afternoon all, I'm Peter Story from the Intelligence and Policy Service for the remit for adults and children's.
Thank you very much and thank you all for being here and Happy New Year. So can I start with Councillor Charwood and then Councillor Rafiq to give us an initial introduction into the areas of your remit in terms of performance update, and then we can go to questions. And if you want to invite anybody else to speak that you may wish to. Thank you. Councillor Charwood.
Okay, thank you, Chair. So I'm Councillor Rebecca Charwood and I'm the Executive Member for Health, Wellbeing and Adults. That covers public health and adult social care, and also chairing of Health and Wellbeing Board, so some health partnership work as well, as it's all integrated together in a wonderful system that we have, thankfully. So yeah, the Ask-Off measures and the performance update is always a really interesting part of the scrutiny agenda for me as well, because looking at the figures and going through them with you periodically, I think is really useful for all of us, but certainly for me and getting your feedback as well. So we've had a very unusual year, given the challenges with COVID and the difficulties about service access and those sorts of things. So some of the figures have changed or responded as a result of that, and you would expect that. But we've had some surprising outcomes, which are really good. So just a few of them. So adult social care quality of life measure, which is the sort of first one on the list. It's gone up marginally, but it's still really good. And we're really happy with that. We're higher than England average. So really pleased about that, because people are saying they have a good quality of life. So that's overall measures excellent. We've had a reduction of the number of people smoking, which is interesting, because the access to stop smoking services has naturally been curtailed, so in person. So that's really good. The percentage of adults over 18 that smoke has gone down to 18.2% in Leeds, and in deprived Leeds is 29%, 29.1. So somehow COVID hasn't impacted that too badly in the wrong direction. Obesity levels have also gone down. So obesity in adults under 30 BMI has gone down, I think, a little bit as well. So that's really positive, given that people have been at home a lot more. Clearly, people have been going out and being active with the advice of the government about that daily exercise. So that's excellent, really positive to see. But things like the NHS health check have suffered a little bit because of in-person visits. I think we would expect that. And then you can see through, and we can talk about any particular issues you want to pick up in the table. The ones I'd like to pick out particularly, I'm really pleased about, are the ones at the end, which are our local measures. So our percentage of referrals for social care resolved at initial point of contact has gone up quite markedly to 33.5 as a provisional number. But that's gone up a lot since the last one, and the jump is much bigger than it was the previous year. So really want to pay tribute to the team for that, given that it's been a really high demand year and very challenging circumstances. The quality of care from the Care Quality Commission for our registered care services, that's our care homes. As you know, we've placed a huge amount of focus on that in recent years, and it's been a passion of mine. So to get up to 87.8% as rated good or outstanding, I'm absolutely thrilled about. I think that's testament to all our work together and the focus that we've placed on it for our older residents and our working age adult residents as well. And the last one, which is the percentage of people with a concluded safeguarding inquiry for whom the outcomes are fully or partially met, that's also gone up to 97.2, and it's a percentage. So again, really positive there. I'll leave it there for now, and happy to discuss any particular points that members would like to. Thank you.
Thank you very much. Can I invite Councillor Rafiq, please?
Yes, thank you, Chair, and a happy New Year, everyone. It's with the lockdown and the virus, nevertheless, it's not a good start for the whole country, but let's hope for the best. As far as active lease and services concerned, like I think all our services, we've had a particularly challenging year, and with the starts and stops of various lockdowns, it's not been easy. We've had over 90 full-time FT equivalent staff who were from active lease redeployed to other service areas such as other social care, schools, waste, city centre, parks, cemeteries, you name it. So staff, we're also been kind of keeping in touch with all our members as well. We've had up to the start of the first lockdown, I think we had over 24,000 members, and the numbers were rising. And then obviously the first lockdown came, we kept in touch. In many cases, some of the calls made by our staff to those members were the only, sort of contact outside their close family. So, and then when we reopened, many members rejoined. We reduced the fees to $16.95. We actually opened the gyms and then swimming pools going back to August. And, many people came back instantly as well, not just in August and September, but in December as well. Staff obviously, had to kind of retrain, kind of get up to speed with everything, all the measures, all the new guidelines as well. So a lot of work actually went into doing all that. We managed to develop Active Leeds Healthy at Home website, Chair, as well. they developed the app to deliver live streaming classes and on-demand fitness classes from our mainstream site, and has been very popular, to be honest, and the numbers are always increasing. And that's something we will look at, obviously, given we are in another lockdown now, to kind of make sure our members are engaged from home, and that will continue. I just want to, praise all the staff who actually managed to kind of ride the storm and carry on, and and also those who've been redeployed as well. So I'll stop there. I know that members will have many questions, and I'm sure there's much I've missed, and Steve and then Phil will actually add, Chair.
Thank you very much. I'd like to echo your thanks and praise for the staff of Active Leeds. We kind of, I don't know how much people are aware of the redeployment into care homes, into our refuse, the recycling service, into parks and countryside, and onto the telephones. And they just did a brilliant job of those transferable skills. And I think it's kind of been life-changing for some people, but some of the comments and stories were really uplifting in a quite difficult, in a very difficult time. And I've very much enjoyed those online classes, and then the on-demand ones, that just brilliant that we could kind of reach out in that way. And that's going to be something that we're going to take forward, isn't it? That, it won't just be kind of going to the gym physically, that online will be part of our offer as well. So I'm going to start with Councillor Trustwell, please, and then I've got Councillor Knight and Dr. Beale. Councillor Trustwell.
Okay, thank you, Chair. Just going through the report, there are 4 areas that I wanted to ask questions on. The first relates to one that Councillor Charwood already raised, relating to smoking prevalence. And it's obviously still a concern that the prevalence of smoking amongst deprived communities is still quite high. And it's really just to ask a question about what we're doing to drive that down. Second point in respect of that is, do we have any feel for the prevalence of smoking amongst young people? I know we don't have access to the same data, but clearly the tobacco industry has always very cynically tried to recruit young people to replace adults who die or give up. My second point relates to the table on page 32 and the ASCOF measures. And the first one at the top, just really to reflect the huge success in terms of adult social care's role in facilitating discharge. If you look at the figures, we've actually made a huge amount of progress, and the comparisons regionally and nationally are very, very good. However, if you go down to the next one, the reverse seems to be true, and I just wonder what the explanation for that is. My next point, or next 2 points, relate to page 35, and this is an issue again which has been raised before at the board, relating to our life expectancy. Over the years, in the last few decades, life expectancy has grown, but recently it's plateaued, and in respect of women, especially in Leeds, it's actually reduced. And I just wonder whether that is still being regarded possibly as a statistical blip, or whether we're now looking and unpicking as to whether there are some real issues that we need to be addressing as part of that. And my final point relates to the bottom of the table on page 35, and it relates to the number of people taking their own lives. Now, we do know from past presentation that we have a really brilliantly formulated strategy working with partners, but the figures still appear to be going in the wrong direction. And I'm just wondering again what we're doing to really convert the strategy into practical action that will hopefully bring down these figures. Thank you, Chair.
Thank you. So who wants to start answering those points and questions?
Shall I do the delayed discharge one first, and then I think the rest were largely for Victoria and public health. So the DTOC indicator is made up of a number of components. So as you rightly can see on the first line, it's only those discharges that are attributable to social care. And as you can see, we perform really well. The second line that you can see relates to delays that are attributable to both NHS and adult social care. And what happened over those years was, in the past, it's about people who are delayed in acute beds. And predominantly it was counting people at LTHT, but there was a whole piece of work on being clear about what we were counting, and we started to then count delays that were in acute beds in LYPFT. So these are people often with quite complex needs that may have continuing healthcare needs. They may be subject to Section 117 aftercare arrangements. So we agreed that until we were clear who had lead responsibility, they are a joint responsibility, and so that's why it took a jump up on the data.
Thank you. Is that okay, Councillor Trustwell, before we move on to Victoria?
No, fine. Thank you for that clarification, Kath.
Thank you. Victoria.
Chair, do you mind me just at this point just saying, does everyone understand all the various bits of, you know, the acronyms and that sort of thing? But yeah.
Yeah, does anybody need them explaining? I think, thank you, Councillor Charwell, because it is always, I miss Councillor Gabriel, and she always wanted a one-page summary, didn't she, at the beginning of every report. Can I invite Victoria, please, to comment on the others?
Thank you, Councillor Hayden, Councillor Trustwell. And Anna Fraser might want to come in on the young people smoking specifically. Just taking them one by one, the lower life expectancy of women, Councillor Trustwell, in deprived groups. I mean, it's useful to point out that in the two sets of indicators in the public health performance, the one that's called the population indicators, because of the time lag in those, the board will notice that these are pretty much all pre-COVID, because they tend to go up to 2019, whereas the operational indicators cover the kind of COVID time of the current year. So I think it's just worth pointing that out. So we are really concerned that we were seeing, up to the end of 2019, the falling life expectancy in women who live in the most deprived parts of the city. That reflects a national pattern. So it's not just a Leeds issue, it's a national issue. And it was raised by Michael Marmot and others as it's the first time we've seen life expectancy going in the wrong direction for over 100 years, and absolutely raises issue around inequalities more generally. So if that's our pre-COVID position, and we're seeing that in women in Leeds, our understanding is that COVID has exacerbated the challenges around health inequalities. So we would be incredibly concerned and focused on proactively addressing that, Councillor Trustwell. So just I guess to echo your raising of that as an absolutely fundamental issue for us in the city. On the suicide question, again, the data on the suicide rate on the paper is up until and including 2019. So again, it's pre-COVID. There was some very recent research nationally which has looked at suicide rates from real-time data in the COVID period. Nationally and pretty much internationally, with a very few exceptions, there is no rise generally in suicide rates. either in England or in most other countries. Japan is a strange exception, interestingly enough. We've also looked at our real-time surveillance through COVID and haven't seen any increase in our overall suicide rate from real-time surveillance. Now, as you know, real-time surveillance is live data. We look at it in more detail in the future too, but that's the current position, that we're not seeing an overall increase, although we are seeing some patterns within certain groups that we would be concerned about, although the numbers are small. So, for example, younger men, we were getting more cases of younger men in the COVID period, so we would want the strategy to focus on that intelligence. So we are tracking that very carefully. It will feed into the suicide plan for the city and the partnership group. So yes, to reassure that will all need to continue to be a priority. And then the last point around smoking prevalence and inequality. Councillor Trussell is absolutely right to point out that the ongoing challenge is to focus our energies into deprived Leeds, because that's where we've still got this difference between the rates, even though, as Councillor Charlwood said, we have seen overall improvement over the last few years. I just want to add that in terms of our operational delivery through COVID, which is positive to see, we've actually seen an increase in over 40% of people who have been accessing support through the online smoking cessation service. And we've had the greatest increases in people from deprived Leeds. So we've had an increase of 59% of people from deprived Leeds accessing smoking cessation support online, as opposed to just 39% increase across the whole city. So we will continue to ensure that our services are targeted at the most deprived parts of the city in order to try to address that gap, Councillor Trustwell, but it will remain challenging post-COVID. I don't know if Anna wants to add anything about the young people's rates, Councillor Trustwell, otherwise we'll take that away and come back to you on that one.
Not very well, unfortunately. No, I don't know about anybody else, but I'm not hearing.
No,
Shall we
I
send
can't
you a
hear
note
anything.
on that one?
I'm quite happy to receive information, as
Okay.
Victoria says, later on. Yeah.
Thank you.
Thank you.
Councillor Charwood, did you want to come in on that? You got your hand up.
Yes, thank you. I will lower my hand. There we go.
Oh, very good. Very good.
Yeah, I just wanted to add to the philosophical point that and the overarching aim that we have in the health and wellbeing strategy that we all work towards and commission from is that we'll help to improve the health of the poorest the fastest, and that's our strapline and our guiding principle for everything. So in terms of stopping smoking services, that's why they will, all our resources are sort of pointed at the most the poorest health, the most deprived areas, but open to everyone. Just to reassure you on that, and just to sort of underline that, because that goes on in all of our work.
Thank you very much. Councillor Trustwell, did you want to come back on?
No, that's fine. Thank you, Chair.
Thank you very much. I'll move on to Councillor Knight, please.
Thank you, Chair. I have 3 questions. The first one is in relation to information given on page 16. And I'm noticing there that we have separate figures for deprived Leeds in relation to cessation of smoking and diabetes, but not for drug and alcohol dependency. And I think it might be useful to have that information in relation to drug and alcohol dependency. I'm just wondering why that's not there. If there's any particular reason why it's not there, and whether it could be there in the future, whether we could have separate figures there. That's my first question. The second one is in relation to page 19. At the bottom of page 19, there's a reference to safeguarding and domestic violence, and there's a reference there about the 4th line up that says that following COVID, there have been periods of variation, but overall, the activity levels are similar to 2019, which is quite surprising because we're all hearing all the time about the increases in domestic violence and domestic abuse generally, children as well. And I'm just wondering, so you would expect there to have been an increase in activity, and I'm just wondering if it's likely that it's just that these incidents are not being reported. You know, obviously, I suppose whilst you're in a confined home environment, is it likely that the people who are the victims of it are simply not able to report it as they would have been previously? And if that's the case, what can we do to give more opportunities for people to report, to access those people who might need our help with that? And my third question is in relation to page 26, and it refers at the bottom there to activities that have been delivered for children, outdoor activities during the previous lockdown, which is fantastic. But the first lockdown, it was fabulous weather. And I'm just wondering, and I know it's early days, I mean, we've only just had the announcement, but I'm just wondering if there have been any thoughts yet about what can be done to engage children and others in activities for this current lockdown, where outdoor activities are going to be greatly restricted. That's it. Thank you.
Thank you very much, Councillor Knight. So, Victoria, do you want to answer on the first point?
Yeah, thank you. You're right, Councillor Knight, that there are in the deprived Leeds column of the data, there are some services that routinely provide that, and some where it's not there. This is a kind of an historic reporting where we haven't normally included that for drug and alcohol services, but I think you're right that we absolutely should, so we can take that away, certainly.
Thank you. And who on the domestic violence question?
Yeah, I've looked at the paragraph in the report. What it does say that domestic violence as a subset of safeguarding was higher, and my recollection of the figures that we track on I get a weekly report, we saw a complete dip in all safeguarding referrals in wave one. Then as wave one lifted, we had it went above last year's rate in terms of the number of referrals, and then it was the proportion that was domestic violence as a part of that has stayed high as far as I can recall. Shona, can I just double check I've got that correct? So overall, safeguarding referrals have sort of caught up with each other. But my perception is that the proportion of those safeguarding referrals that have an aspect of domestic violence to them is above last year's levels. Shona, is that your recollection?
It is, Kath, although I don't have the specifics to hand. The number of referrals for domestic violence that come through to adult social care is a very, very small proportion of those that are referrals generally for domestic violence. So the numbers will vary anyway. But yes, there was an increase following lockdown in the first instance.
Thank you. And from about the active lead about this current lockdown, Stephen, do you want to come in on that?
Yeah, I will do, Chair. Thank you, and thank you for your kind comments earlier regarding the team and what they have been doing as well. It's much appreciated. Yeah, obviously we're still trying to understand all the guidance at this stage in terms of all the activities and what we can and will be able to offer moving forward. But yeah, like similar to last time, we'll try and do as much as we possibly can. A lot of that will be online, like our live streaming kind of classes and on-demand aspects. As kind of Councillor Rafiq already kind of mentioned around a Healthy at Home kind of website as well, that those online resources will be there. Similarly to last time, we kind of produced a lot of toolkits which we kind of distributed around Leeds as well. So again, we will be looking to see what we can offer in terms of that aspect. But yeah, at this point in time, it's probably something which is a bit too early to kind of understand in terms of what we can and can't necessarily do out in the outdoor environments as well. But we will be working away at that during this period of time just to kind of see what we can do. And the team have been quite innovative in terms of what they have been able to offer. So I can keep you updated in terms of that, Councillor Knight, in terms of what progress we kind of make in that area. But it's definitely an area for us to kind of still kind of progress with as quickly as we can do, really.
Thank you. And the materials were fantastic in the first lockdown, but and especially families with limited space inside, and as Councillor Knight says, with the weather being completely different kettle of fish, to be honest, to the first lockdown, it's going to be far harder to keep kids active. Councillor Knight, did you want to come back on any of those comments?
No, that's very good. Thank you for the answers. Thank you.
Thank you. Thank you. Dr. Beale, please.
Thanks, Chair. Mine is perhaps not so much a question, but just drawing attention to one or two of the things of concern. And it follows Councillor Knight's question about physical activity. On page 21, there's a series of key points, and I just want to draw attention to two of them. The first one is activity levels fell for all socio-economic groups. The decline in activity was larger amongst lower social groups. And the other one is drops in activity levels were larger amongst BAME communities. Now, those communities where the activity levels fell are those very same communities where health in general is poor on the whole, and also where COVID has been more prevalent as well. So, I mean, we need to sort of look at what can be done about that. Maybe one of the reasons that the activity levels are lower are the less availability of open green spaces for walking, for jogging, for running, and so on. But at the end of those bullet points, it says this and ongoing research will help to shape future activities and interventions to ensure the benefits of active lifestyles are realised by all Leeds communities. So it's just to say to those officers responsible for looking at how we can increase active lifestyles, we do need to look particularly at the more deprived sections of our community.
Definitely. Would somebody like to respond to that? Because it's very well articulated, the link between, those who suffered more from COVID-19 or are suffering more from 19 and the drop in activity levels as well. Stephen, you've got your mic off mute.
Yeah, thank you, Chair. Yeah, it's something that's highlighted in the report that we kind of digested. Obviously, that early report is still early days in terms of what we kind of understand from the last period of the lockdown and the likes in terms of this period of time. But yeah, it's probably fair to say that that is correct at this stage and is something that will shape and how we kind of move forward with activities, especially again now going into another lockdown as well. It's going to play an even greater impact in that. So how we then do and what we do coming out of that is going to be vitally important, and it will be based on a lot of research and data that we kind of take away from that to kind of look at what we can do to try and address that. Similarly to, it's not only kind of the BMEs kind of communities, but it's also more prevalent in males as well, which is another worry as part of all that they've seen a greater impact and not access some of the resources that we have put out in terms of the online side of things. It just seems to be more kind of geared towards women areas and the likes as well. So that's another area that we kind of need to progress with and see how we can address that off the back of this. But you're definitely right around that.
Thank you. Did you want to come in, Victoria?
Yes, thanks, Councillor Hayden. Just briefly, I think reflecting Councillor Charlwood's comments earlier about the absolute focus of the health and wellbeing strategy on improving the health of the poorest the fastest, we know from all of the research so far around the impact of COVID, and particularly from the work that Professor Michael Marmot put out just before Christmas on kind of resetting after COVID, in a fairer way than because of the new challenges around health inequalities that are exacerbated by COVID. And I can only support Dr. Beale's comment that I think that even though we've always focused on this issue as a city, the need to focus on it at an even greater level will be with us through COVID and beyond. So the next time we bring the population indicators, it should give us a good position of how they've played out through COVID. And you know, I suggest that we will be having this conversation about inequalities, you know, in an even sharper way then, because we know and we expect that that will be one of the legacies of the pandemic, that we'll need to apply all of our energy that we've used in the pandemic to the longer health consequences that will play out as a result of the pandemic. So yeah, I just support those comments, Dr. Beale. Thank you.
Thank you. Dr. Beale, are you okay with that?
I'm fine. The only other thing I would just draw attention to is that Leeds has done better than the other core cities. So although we've still got a way to go, we are doing better than they are elsewhere.
Thank you. Councillor Lay, will you indulge me, and can I bring Councillor Reagan in first? It's just that she's got a cluster meeting at 2:30. So
yeah, that's fine.
Yeah, thank you. Councillor Reagan. Oh,
it's linking on to the points that John Beale's made, and I think although we've got to look at our poorest communities and our health inequality communities, we've also got to take into account our people with CEV and the ones that are currently shielding, and their opportunities to exercise and to get out there more and do more physical things is it a greater challenge for not only them but for us as a service to try and provide those opportunities to them. So I think we need to look at them as a high risk group, and we need to really make some changes into our programs of how we integrate with those people that have those not only learning disabilities but have physical disabilities and really long-term health conditions.
Thank you. Who would like to respond to that?
Well, if I could briefly, Councillor Hayden, just agree with Councillor Reagan's comments. In terms of the inequalities work, that I fully support that needs to be around communities of interest and groups of people who have more barriers to achieving health than just geographical areas of the city, although that's important. So quite rightly, people with learning disabilities, people with enduring mental health problems, etc. So yes, thank you for your comments, and I fully support those.
Thank you. Stephen, is there anything differentiated from Active Leeds with people with learning and or physical disabilities?
In terms of, there is a little bit, but we just need to understand a little bit on front of the guidance and stuff. But yeah, we can kind of do a little bit more in terms of people who have disabilities and likes to kind of do activities. It's kind of staying outside at this stage, so nothing necessarily indoors, but we're still kind of working with Aspire and Adult Social Care in terms of using our facilities during this period of time as well. So again, we just need to understand a little bit more detail around the guidance, but we're hopeful that we will be able to offer some aspects of that through this lockdown period as well. But yeah, I totally agree with Councillor Reagan as well in terms of the points, and that's why we kind of focused a lot of our attention on the telephone calls and likes to people who were shielding and likes, just to keep in touch with them. But we also offered kind of physical activity advice to them and gave them a lot of resources to be able to still kind of maintain that period of time as well. So we'll look to continue that into this period of time as well.
Thank you. Councillor Reagan, would you like to come back? No? Okay, thank you. Councillor Lay.
Dominic, it's like you read my mind. I was going to briefly discuss learning disabilities. And I was going to congratulate the teams on the ASCOF 1E measure, which, although still low, this is on page 31, sorry, appendix 2, which talks about adults living with a learning disability in employment. That's risen for a 5th year in a row. Still relatively small numbers, of course, 8.1%, but significantly better than comparators and the national level. So we're doing something good there. So thank you for everybody that's helping to get those people living with a learning disability into some paid work that is of value to not just them, but also to wider society. The second question was really going to be about, and we don't say this much about Leeds City Council when it comes to adult social care, but it is ASCOF 1G on the same page, and we're below average on having people with a learning disability living in their own home. I wondered, progress is being made, but it's relatively slow, I think. Do we know why it's taking us so long to get more people living with a learning disability out of their institutional care and into either some form of assisted living or living alone? That was all I was going to say, really. Thank you.
Councillor Charwood, did you want to come in there?
Yes, thank you very much. I'll lower my hand. We're trying to be good. And
you are being very good.
Thank you, Councillor Lay. I just wanted to come in on that because I've had some discussions with members about this recently, and you know, with budget pressures as they are, sometimes we have to take measures which you know, we don't want to take, and with a heavy heart and all of that. So what we tried to do, what the officers tried to do, is find a way to achieve both things that you've described there, as well as making our budgets you know, work for us and achieve the bottom line. That's a really hard thing to do, and it's this time of year when we're having to look at that. So one of the things that can do both of those outcomes for people, to deinstitutionalize people's lives, and we've been on this journey now in adult social care, mental health world, learning disability world for 25 years or so, where we were trying to integrate everybody in society. Let's have a sort of a community which accepts all our members and not hides people away in institutions, and also allows people to live their lives in a way they want to live it, to have a job, to contribute somehow, to socialize, and not be you know, in an institution. And there will maybe always be certain people who will require that sort of care, but you're right, we need to reduce that down and do everything we can and provide that impetus to get people into a life that they want to live, and that hopefully would include living in their own home, either with their family or unsupported living, as you say. But ultimately, that's a strength. It's what we would call a strength-based way of delivering social care, which should, you know, help us to manage our budgets, because care homes for people with learning disabilities are very expensive places for people to live, and they're not potentially delivering the life that that person wishes for, or their family wishes for them. So we're trying to do both things at the same time. So I really appreciate you raising it, because I think I'm just saying that we're trying to do that sensitively and appropriately for our vulnerable residents, and have a better society where we all live together.
Thank you. Kath Roth, did you want to come in on that as well, please?
Yeah, I just want to add a little bit about this technical aspect of this indicator, which we probably sell ourselves a wee bit short on the progress made on people being able to live in their own homes. So in order to be able to count for the indicator, you have to do a review of that person's needs each year. So you can only count if you've done a review. So if we haven't reviewed as many people as other places, we can't count it against that indicator. So we have a bit of a dilemma really about where we target our social work resource. So is it around proactive cases of people who are coming forward, either in transition, in crisis, or do we do the routine reviews so we can count it against the indicator? So I sort of say this every year, actually. It is an indicator that we know we don't benchmark well on, but from my experience of working all over the country, I actually think Leeds does very well in terms of non-institutional care for people with learning disabilities, but we just need to be able to up our review performance.
Sam, Councillor Lay, would you like to
Yeah,
comment?
no, that's fine. Absolutely, Rebecca, I understand all of that, and yeah, and Kath, I also understand that. I guess a better indicator would be how many people living with a learning disability get a yearly review, you know, because if it's yearly reviews that are stopping us from, because, you know, it is a crude indicator like school league tables, you know, and there's always a nuance behind it. But if I was somebody living with a learning disability or a member of their family, I'd be looking at that and thinking, well, you know, 1 in 5 still aren't living in the care and in the community that started in 1988, I think, something like that, you know. And you're right, some will, you know, some people have significant needs or emotional needs that require them to be in some form of what you would euphemistically call institutionalized care. But there are also many who could be back in the community or in the community who are being held back possibly by not getting a yearly review. Thank you.
Thank you. Councillor Latty, can I bring you in, please?
Thank you, Madam Chairman. I just wanted to be supportive of this and say that within my own ward, this has happened very, very successfully. We've got 2 or 3 centres where people with learning difficulties are living happily outside what you might call control. People who I used to meet in local pubs when they were resident in a residential home within Rawdon, and when the change took place, I now meet the same people out and about within the ward, and it works very well indeed. They're happy as Larry, and it's certainly where we can do it. It's very, very good.
Thank you, Councillor Latty, for those comments. It's really appreciated. Right, okay, I've no more hands, so are we happy to move on to the next item? And just thank everybody for this performance report and for the answers to the questions are really involved, and appreciate it. So if we move on to item 8, which is the financial health monitoring, and can I introduce or ask John Crowther to introduce himself, please, as I did in the previous item.
Sorry, Councillor, struggling to find the mute button. Yeah, my name is John Crowther. I'm the Head of Finance supporting adults and health.
Lovely. And then we've got the same people that were introduced in the previous. So if so the purpose of this item is to consider the projected 2020-21 financial health position of those service areas that fall within the board's remit at month 7, which was October 2020. So Councillor Charwood and Councillor Rafiq, if you would like to give initial comments in relation to this to your areas, please, and anybody else that you'd wish to bring in, and then if there's any questions, we can go to those. Thank you.
Do you want me to go first?
Yes, please. Sorry, I'll just alphabetically.
I'm going to keep it very brief and allow John to take you through the more very complex, huge area, and then, you know, pick up any questions that people have afterwards, if that's okay.
That's fine. Sorry, are you going to speak, Councillor Charwood?
Sorry, no, I was saying I would.
You just said, so if we go to John then.
John Crowther can do introduce the report, and then I can pick anything up that's of interest afterwards, if that's okay.
That's fine. Yeah. So John, please.
Okay, sorry, Councillor. Steve, how do you want to play this? Because we had a brief discussion earlier.
Well, yeah, we both know it as well as each other, so happy for you to do it, yeah.
Okay, thank you. Okay, so in terms of the period 7, as we call it in finance, overall, the council is now projecting a balanced position, coming from quite a difficult position, as previously reported on COVID. From a starting point of a budget of 525 million, we had savings to deliver of 28.4. And that's how the year started until COVID came along. And we're now reporting pressures, COVID-related pressures of about just under 112 million. Financing issues around COVID, council tax, etc., added another 50 million to that. And then the council decisions around Eli added another 14 million. So basically, we were looking around about pressures of 178 million before we put some mitigation in place. Excuse me. A number of savings, non-COVID related, use of earmarked reserves, elements of government funding have brought that figure down to 130 million. Government specific COVID funding of 88 million has dropped that further to 42.5 million. But that 42.5 million represents, excuse me, I've just had a quick drink before. Shortfall in the collection fund, and the machinations of how the collection fund works. I hope you won't ask me because I couldn't explain it anyway. Really affect next year. So that basically, that pressure gets moved into next year. So that's why we're projecting a balanced position, which is a change from where we were looking previously in terms of capitalisation directives, etc. More specifically around social care and public health, adult social care and public health are projecting a pressure of 12.6 million. Public health is all wrapped up nicely in a ring-fence grant, so that's there aren't any problems foreseen in there at all, and potentially a small underspend. But again, because it's ring-fenced, that has to be carried forward and spelt on public health. In terms of adults and health, it is incredibly complicated. Whether you can see at the appendices, I've already got the copy of the report, councillor, so I'm not sure what page this represents, but it's in the appendices, the financial dashboard. And in there, there's a difficult to read spreadsheet. And just to give context, there's 27 million pounds of costs above budget. There's 18 million pounds of income above budget. So it's a very complex picture. So what is probably, I would hope, the easiest way to tell you is that we've tried to split that when we've been reporting from a finance perspective to the directorate and corporately. We split that into COVID areas, fully funded government areas, and how things are working away from COVID. I hope that makes some semblance of sense. In terms of COVID, so we're saying that the pressures associated with adult social care are entirely COVID related, 12.6 million. And there's an element, the small amount that is related to staffing. There's an element related to buildings, although that really is basically around the use of the waterside building for PPE, and I understand now a temporary mortuary. We have community care packages or costs associated with community care packages of about £8 million. This is all COVID, remember, sorry, just to re-emphasise. Commissioning costs of 1.4 million, where we've been trying to meet pressures within the care sector, as well as costs of PPE, and some general running costs and income. Income is a pressure of about 2.5 million. We also need to point out that we did have around £14 million worth of savings plans planned for 2021 within the directorate, and about 3.5 million of those will not be delivered. But that is included within the 12.6 because they are COVID related. They are specifically because officers who had been asked to deliver those have necessarily been focused elsewhere on delivering COVID. I think from my perspective as the accountant supporting the directorate, that is slippage. It is not failed action plans, it is slipped action plans that will be delivered, and we've sought clarification on that recently. So they will be delivered might be a little bit towards the back end of this year, but certainly we're planning for a full year effect of those next year. I think sort of around that, I think there are a couple of things to point out from a social care perspective again, is that it is a very fluid position. On one hand, we can see elements of social care, provider social care dropping, but other areas increasing. We've had areas for the first 6 months supported specifically by the CCG stroke DHSC, and a transference of those costs for the next 6 months. So it's a little bit fluid as to how that really will turn out, but that's the current position as we see it. We have received within the directorate grants for test and trace, the original £4 million, infection control grant of £13.5 million, but we're showing those as being completely matched with expenditure, even if it hasn't necessarily been incurred yet, to try and unmuddy the picture. Hopefully that makes some sense. And we've also received, at the moment, the reports are showing 2.2 million. We have received another £1 million from the DHSC stroke through the CCG after this period to support costs that we're incurring. And I apologise, this is a bit rushed, but while I've got your interest. And the things that are away from COVID, the directorate has made significant savings on staffing, community care packages. We're slightly over, particularly around home care, on the non-COVID related stuff. General running costs are pretty much on target. And there's something we call, we're going to be using less of reserves for a certain element of what was planned expenditure. But it's important to say, councillors, that Adults and Health will be utilising £3.5 million of their earmarked reserves to assist the overall position for the council. So when I spoke earlier about us having a nice balanced 42.5 million that was next year, it's basically it's how we've got to that figure to ensure we've got a balanced position for the council. There's a lot in there, but as Councillor Trussell reminded me last year, we perhaps don't mention enough, but it's a huge thing for a directorate. So I've tried to give you the key areas of where we are in terms of the current projections for this financial year. But I'm happy to take any questions, obviously.
Thank you. I've got a question from Councillor Lay, please.
Yeah, I'm really sorry. I'm not great with finance. If we mentioned earlier, if Councillor Gabriel was here, we'd want a one-sheet summary. I'm really sorry, John, but what do I take back to my community when they say, how's the council managing with its adult social services in COVID? Do I take back that we're doing okay, but we need more money from the from central government? That, you know, we've done well till now, but we're now in a third lockdown that is likely to go through to the year end, and we need more money? Or I don't really know what I'm saying, really, other than there's a lot of facts and figures there, and I could do with a praisey, really, of a simple message to take back to my community as how we're doing. Thank you. That's just an acknowledgement of my stupidity, really.
Sorry, Councillor, I would say not at all. I love figures, so I think it's me the one that you should be worried about. I would always say, as the accountant, but even if I was a member of adult social care and public health for that matter, we do need more money. Personally, sitting outside the service but very close to it, I think they've done a damn good job in how they've managed social care for several years. Excuse my language, but and in particular this year, they have met all that they have needed to do. But at the end of the day, we will overspend social care by 12.6 million at this stage, and that is COVID related. Away from that, to the very best of my knowledge, all care that is required is provided. The council does provide, in my opinion, good value for money in terms of its social care. It meets the needs. It is always on the front foot in trying to find different ways, but better ways, more effective ways, as Councillor Charwood referred to when talking about learning disabilities a few moments ago. So yes, we need more money. Yes, we're overspending, but so is every other authority in the country related to COVID. And perhaps just to tag it on too long, the Directorate has consistently managed its budget over the last few years. And if we hadn't have had COVID, I'm absolutely convinced we would have done so again this year. So I hope that gives you some confidence, Councillor.
It does. Yeah, 12 million is, well, I was going to use a swear word, but I'm not allowed. It's pretty good as a council. I'm very proud of Leeds City Council's Adult Social Services. Thank you, and thanks.
Thank you, Councillor Lay, as am I. Councillor Charwood, did you want to come in? And then Steve, if you wanted to come in as well.
Yeah, thank you very much. Thanks to you, Councillor Lay. And I'm always really heartened by the cross-party care and devotion for social care and health in the council. I'm not sure it's the same in every council, so it really is wonderful that everybody cares so much about it and that we can pull together if we need to on certain issues. So yeah, that's why I let John go first, because the complexity of the way that the budget is managed is very, very much better to be explained by John. And I've done this portfolio now coming up 5 years, and every month I get the monthly period like we have here, and it's a balanced budget almost every time. And we have huge demands, and we have winter pressures, and we have all sorts of, and our budget is very large. But so is the demand, and it takes a lot of forward planning by officers, Kath's team, very much so, Shona's team, and in calculating the need that's going to present itself in order to then have the budget to deliver that and not be in year scrambling around trying to find money from somewhere else to deliver that. And John is absolutely right in that I have a huge amount of faith and admiration for how they do that year in, year out. So this year is very, very particular with COVID's pressures, but also the budget pressures for next year as well. It's incredibly, incredibly challenging and very difficult for those of us who really care, which I know we all do, about our services and the people and the outcomes for our more vulnerable people. So it is incredibly difficult, but they do an amazing job and I'm very proud of them. So yes, thank you.
Thank you. Absolutely. Echo that. Steve, did you want to come in?
Yeah, I think it was just to add to sort of Councillor Lay's takeaways that in overall terms, whilst we're projecting an overspend of 12.6 million before the use of reserves, that pressure is entirely COVID related. As John explained, partly as a result of us not being able to deliver some of the budget action plans, which would have required us to, in effect, have contact with people that we couldn't otherwise have. But I think the other big takeaway was the support that we provided to care providers within that. There's at least £5 million worth of the council's resources that has gone into providing additional support for care providers in Leeds, particularly in the early 3 months of the pandemic. And I think you, Councillor Hayden, were party to some of those decisions that we had to take at the time to actually just make sure that the care sector could get through that first 3 to 6 months. So I think there's at least 5 million of the total that went on that. So I think those are important to understand. And whilst we've had to use some of our reserves, I think we've been fairly prudent in terms of making provision for what we might call rainy days. I don't think we ever anticipated we'd have the torrential rain that we have had. But having said that, our sort of financial planning has stood us in reasonably good stead for this type of event, if anything can. Okay, hopefully that helps.
Thank you very much. Yes, definitely. Shall we move on to the active leaves and remit? Councillor Rafiq, if you wanted to introduce that and ask officers to speak on in terms of that budget.
Yeah, I'll just briefly kind of touch on it, and then Phil and Stephen will come in. On active leaves, as you know, we rely heavily on income we generate to run the service. As the 9th biggest operator of leisure facilities in the country, which is private sector as well, the pandemic has actually impacted heavily on our income generation. As of period 7, I think we had a downturn of 10.3 million on our income, and I know the government will reimburse us 75% minus first 5%, which we got to go for. So, but that still leaves a big gap, and I think the new lockdown will provide even more challenges, Chair. I'll stop there. I'm sure the experts have got the details there. They'll add more to it, but we're happy to take questions at this point. Yeah.
Okay, thank you. So, is it Phil?
Yeah, thanks, Chair. And Councillor Rafiq has covered it realistically. It's a much more simpler position in relation to Active Leeds in terms of this scrutiny board, because it's a single service. It's a £10 million sort of reduction in income, completely COVID related as a period 7. We need to do some modelling for period 9, which is due next week, but obviously with the introduction of this new lockdown, we expect there to be a worsening position. Yeah, and happy to take questions on it.
Thank you. I've got nobody indicating at the moment. I take it that we're all quite happy with that analysis. So shall we move on to the budget proposals then, item 9. So, and this is to provide board members with the Executive Board's initial budget proposals for 2021-22 for consideration, review and comment on matters and proposals relating to service areas that fall within the Scrutiny Board's remit. So we've had a copy of the relevant reports presented to Executive Board for its meeting on the 16th of December 2020. Scrutiny boards have already considered the proposed budget saving proposals that were approved by Executive Board in September, October and November. A composite report summarising scrutiny feedback during this first phase of consultation was presented to the Executive Board in December for consideration, and this is set out in Appendix 3 of the Executive Board's report. So if we can invite Councillor Charwood and Councillor Rafiq to give any initial introduction to the budget proposals for 21-22. If anything else to add, and if officers have anything to add, and if there's any questions. But it might be that we have a further discussion later on when another for the February Exec Board meeting, and we may have to have another meeting to discuss these with the ever-changing situation. So I'll invite Councillor Charwood first, please.
Yeah, I think similarly to the last item, I think maybe Kath would like to start with this, or is it Steve?
Yeah, I'm happy to take members through it. Again, if we thought that the period 7 position was complex, putting together the proposals for the 21-22 budget has been something, again. I think the size of the financial challenge that we faced as a council has been very well documented in terms of 119 million was the initial gap that we've been looking to complete. Which has largely necessitated our approach in terms of putting proposals together for, certainly in our case, September, October and November executive boards. The adults and health side didn't have any further proposals going to the December executive board on top of what had already been considered in terms of September, October and November. Although there are still some cross-council reviews that are being undertaken at the moment, which one of which may have an impact upon adults and health in particular, both adult social care and public health, which is a review of commissioning services. But that review has not yet concluded. I think that the major standout in terms of the December report, on top of what members had already seen previously in terms of savings proposals, was the outcome of the comprehensive spending review. And one of the things that, whilst in overall terms, and it's subsequently being confirmed that the council's overall financial position is potentially about £500,000 better off than we expected in terms of the December report. That does include the opportunity, and I'll say that in inverted commas, to raise a 3% adult social care local precept, which is a concept that we've had for a number of years now, which in effect allows local authorities to raise additional local funding for, in a sense, services which should be part of the national burden. But having said that, the proposals that have gone to exec board in December are based upon the council levying that 3% precept for 21-22. And just to give you an idea in terms of the impact of not levying that 3% precept, it's about 3.3 million per 1%. So potentially up to nearly £10 million if it was decided not to levy that precept for 21-22. The subsequent guidelines indicate that 3% increase can be undertaken over a 2-year period. My understanding at the moment is no final decision has been taken on that adult social care precept. However, I just wanted members to be aware of the significance of that, particularly in relation to our assumptions in our medium-term financial strategy were that the extra £1 billion a year that was promised by the Prime Minister, that would be provided in grant form to us, together with an equivalent grant in effect to the value of a 2% precept, which is what we're used to, which would have given us about £16.6 million towards social care pressures. However, the £1 billion turned into 300 million nationally, and as I've outlined, the precept rules allowed us to raise a 3% precept locally. Even if we did the maximum of that, it would only get us to £14 million. So again, we were already £2.6 million worse off from a social care perspective than we expected within the overall settlement. Just to put again the decision around the precept level, which will be decided at full council in February, even with a balanced position in terms of 21-22, then the estimated financial gaps for 22-23 and 23-24 currently stand at 55.7 million and 32.4 million across the whole council. So again, it puts into perspective in terms of we are very much between a rock and a hard place in terms of our decisions locally in terms of funding. To add a bit more difficulty, we've only got a single year comprehensive spending review, where we were really looking at a 3 to 4 year spending review period to give us some certainty for planning purposes. Clearly, we've not got that, and whilst we can all understand the reason behind that in terms of the pandemic, nevertheless, it doesn't make planning any easier from a social care perspective. And probably most importantly, there was no mention of the sort of resolution of the adult social care funding crisis to which it's been referred within the settlement, other than it'll be considered in the future. On the positive side, I think it's worth reflecting that in table 14 in the report does refer to the £80 million worth of cost pressures that have been included in the 21-22 budget before we got to the £119 million gap. And it's worth remembering that 17 million of that 80 million relates to adult social care budget pressures, which is largely around demand and demography. Every year, just really to stand still, the adult social care budget needs to go up by about £17 million a year. So that gives you a context in terms of the December report has been put forward in terms of both the council and adults and health. In terms of the sort of the detailed proposals, I don't propose to go through each of the detailed proposals, other than to say clearly, for us to be able to spend in adult social care or adults and health, the additional £17 million worth of cost pressures which we know will incur, then we're needing to find savings of £18 million. And that's what's been presented both in terms of the working group papers, previous exec boards, and is all culminated in the report to exec board in December. I mean, I'll probably leave it at that for now in terms of, I'm quite happy to answer questions on any of the details of any of the proposals that we've had.
Thank you very much. Councillor Charwood, if you wanted to come in there, and then I'll take a question from Councillor Lay.
Yes, thank you, Chair. Thank you to Steve for that. It is incredibly complicated and comprehensive, very, very big budget, but huge pressures. So it just takes so much very, very technical accountancy measures and planning to get to this point with it. Obviously, as individual departments and directorates, we're sort of given a slice of the cake from the whole council, and then our challenge is to find a way of doing what we do in the best way possible. So, you know, with that in mind, we've had to find, I think, or we were asked to find up to 50, million from I think the gross budget's around 300 million, but our net budget's much smaller than that when you take into account fees and charges and what we bring in. But I just wanted to say about the council tax precept that it really isn't a sustainable way of increasing the funding to local government by increasing the council tax by 5% every year to the people of the city. We've been promised a settlement and a long-term funding green paper by the government for so many years now, and I don't wish to get too political about it, but it is something that I wish to put on the record, because when we're trying to find a way forward over the years ahead, we have no certainty over that, and all we have to go on is an increase in precept council tax. I'm sure we'd all agree that that is suboptimal for our constituents, whichever party we're representing. So we would just really pressure and ask government to get to a point where they can give us some certainty about funding and we can plan our services better. But I'll stop there. Thanks.
Thank you very much. Councillor Lay, if you want to ask a question.
Please, thank you. A government that promises much and delivers little. Where have I heard that before? 1 billion for us and or for adult social care, and we get 300 million. Anyhow, no politics. I just wanted a question and clarification of Steve, really. And page 169 of the first statement from phase 1 budget consultation with the scrutiny committees, section 72 and the Leeds Sailing and Activity Centre, we had asked that we needed more detail analysis, but I think section 73 was more of the issue that just concerned me a little bit, and I just needed clarification, really, because I wouldn't want the executive board to get the wrong idea about who uses the service at the LSAC. It says that the schools using it are primarily in the Yeadon area. That wasn't my understanding, and that it was a citywide service that supports schools across the city. I wouldn't want exec board thinking that we were being parochial in not wanting it to close in Yeadon and Leeds Northwest when it's a citywide. So if Steve could clarify that, I may be wrong, and it may only be Yeadon school kids that are using it, but that wasn't my understanding. Thank you.
I'm not sure this is our
no, I think it's
savings. I think it's active lifestyles.
Yes, it will come under that. Yeah. So can I ask
sorry, I meant Stephen Baker, not Steve
yes,
Hume.
Steve, yeah.
Sorry.
Don't worry, yes. Steve Hume.
Yes, that's who I meant. Yes.
Which I'm not going to put you on the spot there. Yes.
Am I in the wrong part of the meeting then?
No, it's just that we hadn't gone on to active lifestyles.
Oh, I'll come back to well.
Shall we take Councillor Anderson, is your question on the adult social care budget?
Yes.
Yeah, so we'll go to Councillor Anderson, and then we will come back to, and Steve Baker will have made a note of your question there, so we'll come back to that. Councillor Anderson, if you want to ask your question.
Okay, thank you, Chair. I'm just looking at Appendix 2 of the paper where it breaks down all the different savings for adults and health. Now, in previous papers and at the budget meeting, we looked at this, and there was a proposal to reduce funding for the neighbourhood networks and other associated type of activities, but I cannot see that now in here. Has that now been removed from the savings proposed?
No, it's still there. Just having a look at.
It's. I think at the end of Appendix 2, there's what's determined as service review areas, and I think the figures you'd be looking for are 381,000 for working age adults and 502,000 for older people's services. The older people's services includes the neighbourhood networks.
Sorry, I see that now. Yes, I couldn't find it before. Sorry, I see it now. Thank you.
So in total, there's 883,000, which we're currently through Forum Central are supporting the work to work with the sector in terms of how best might we, in effect, achieve that reduction rather than doing a 10% per organisation, which was what the figure was originally based upon. We were working with the voluntary sector to understand how best we might apply that reduction. My understanding is that those discussions are ongoing and are going as well as they can do in terms of when you're talking about taking £800,000 worth of expenditure out.
No, it was just I couldn't see it before. I see it. I mean, it's not fine. It's terrible, but it was never going to be 10% off of everybody. I think the director had made it clear that that would not be the case. It would depend on the discussions. So if those discussions haven't yet been finalised, I assume we'll get an update on that at some point.
That's right. Yeah.
Councillor Charwood, did you want to come in on that?
Yeah, thanks. I think we had an update on this issue about that we had made a statement about publicly about some of the COVID money. I don't want to speak to that, please.
So while there will be an underlying net reduction, we are attempting to mitigate some of that through the use of the test and trace money, because our neighbourhood networks are playing a key role in supporting citizens during the COVID period. So I think there is, probably John will know the precise figure, but quite a significant sum of money will be going as a one-off figure to our neighbourhood networks, which will hopefully mitigate some of the impact, at least for 12 months.
Can you confirm that, John? Yeah.
Sorry, I was just going to. I've been doing this for a while. I'm still struggling. I was trying to type a note on the side. Apologies, Catherine and Councillor. It's about £500,000 is the sum that we're looking to push that way.
Okay, thank you very much.
Chair, I just say that that's significantly, it's a significant amount of money compared to the cut that was intended, which was a 10% cut of the whole budget for neighbourhood networks is around £2.5 million a year. So if we're putting in 500,000, that's more than we're cutting. To me, just for basic mental arithmetic there, but so we're doing everything we can, Councillor Anderson, to protect our neighbourhood networks, recognising the role that they play in the city, and we've increased their budget year on year, and we've got NHS funding for them as well. In my time as exec member, because we really value the work and want to make sure that they are stable and continue to do the work they do. Thanks.
I don't think the budget has been increased year on year, but I accept that if there's £502,000 to be found, and you're going to pump 500,000 in from the other money, then that should almost match.
Sorry, can I just correct that, Councillor Hayden?
Yes, of course.
So when we put the neighbourhood networks on a new contract a couple of years ago, the board which I chaired that agreed that, it was a cross-party board that agreed that new contract, puts them on a 10-year contract and increased the funding by £500,000 across the neighbourhood network, which is a significant increase, obviously. They were intended to be cut by 10%. 10% of 2.5 million is 250,000 as far as I can see. So the increase of 500,000 is above that. just to say we have increased there, and we've got £300,000 of NHS money going into neighbourhood networks as a result of our relationship with them, the NHS. So, you know, we have really significantly increased the funding to neighbourhood networks. I think that's true to say. Thank you.
Definitely, because I remember when I first came into post, the discussion about the NHS because providing funds for the neighbourhood networks, and that's come to fruition, as well as the raise from the council as well. So it is significantly, they are significantly on a firmer footing than they were when I first came involved with them, definitely. Shall we go now to active leads? I don't know if you want to say anything, Councillor Rafiq, and then can I introduce Jill Stewart, please? If Jill, if you'd like to introduce yourself, and thank you for joining us.
Hi, yes, good afternoon. I'm Jill Stewart, Principal Finance Manager for City Development.
Lovely, thank you very much. So, Councillor Rafiq, if you...
Yeah, thanks, Chair. I don't think we've got anything new other than what's been reported previously to scrutiny. Namely, I think there's three sort of bulky issues or items, which I think one's Councillor Leigh has already looked into, which is the sailing centre, and then it's the Chippendale pool, and then there's a proposal to deliver operating efficiencies within John Charles Centre for Support in conjunction with the unions and staff. I'll stop there. I'm sure Jill and Ethel might be able to throw some more light on if people have got questions. Yeah, but the two, all the three proposals I mentioned have been kind of subject to consultation. Yeah.
Thank you. Before we go on to Jill, and if there could have an answer to Councillor Leigh's question about the Eden Centre, please.
Chair, probably helpful if I'll pick up what the generalities and then get Steve to answer the specific if that's helpful. Yes. So just to reaffirm to the board that what you've got in front of you are proposals that you've seen previously. There was nothing new brought forward in terms of the December executive board. The proposals, as Councillor Rafiq has outlined, include three that are sort of public facing, i.e. Leeds Sailing Centre, Chippendale Pool, and some changes at the tennis centre at John Charles Centre for Sport. We're progressing the proposals as approved by Executive Board, and the consultation process was underway, and it should have closed sort of yesterday. We haven't yet done any analysis as to what that has come back with yet, so I can't really share any greater light on that. And then if we can ask Steve to answer the Councillor Leigh's specific question about the demography of users at the Sailing Centre.
Yeah, I'll pick that up. Councillor Leigh is correct, as following all our discussions that we've recently had. So yeah, I don't think it's necessarily quite right that it's said primarily in Yeadon. I think it's the north of the city is more prominently rather than just the Yeadon itself. So yeah, schools do come from all over Leeds and outside Leeds in some regards as well, but it's prominently probably the north of Leeds kind of area that we get more kind of schools attending rather than the south of Leeds, for example. But yeah, the word Yeadon probably misconstrues that a little bit.
So do we have any figures on kind of, where children and young people are using it from?
Yeah, so we've got a list of all the schools that use the area and facility. So yeah, that's where Councillor Leigh just picked that up from. So yeah.
Yeah, would we be able to see that?
Yes, we can share that. That's no problem at all.
Thank you. Did you want to come back at all, Councillor Leigh?
Yes, I just wondered how we got the Scrutiny Board recommendations to reflect that view, rather than, because I am concerned that exec board members will sit in exec board and make a decision based on information which suggests that this is a parochial issue of the sailing club, when it is obviously much wider than just my ward. So I wondered, how does, and I don't know how we do that, but how do we change that so that the exec board members get a true reflection of that paragraph?
If I could, sorry, Angela, I was going to say, Chair, probably helpful to say that what the exec board recommendation was to approve consultation, and then decision making will be a delegated matter for the relevant director in consultation with the executive member. So Councillor Rafiq, who's obviously attended this meeting and attended previous meetings, will be aware of that. But I can give Councillor Lay an assurance that I'll drop Councillor Rafiq just a note of it, so we've got a record of it, if that's okay.
It's fine, but as long as the decision maker is aware, that's fine. Thank you.
And just to confirm as well, in relation to this item, that any additional comments or any recommendations that's made by the Scrutiny Board during today's meeting will inform a further phase 2 composite report by Scrutiny that will be going to the Executive Board at its meeting in February. So we can actually put some wording in there to rectify that.
Excellent. So if we get the figures of the different schools and etc. that use it, and if that's shared with the board, and then it can go into making it a fuller document, and so that the exec board are more are aware fully of the impact that it may or may not have in terms of that facility. Thank you very much. I'm not seeing any other. Jill Stewart, is there anything you wanted to add in terms of active leads?
No, not at the moment, thank you.
Okay, thank you very much. Okay, so I'm not seeing any other hands up. Thank you very much for that. It was actually really, I kind of dread this meeting. Actually, that was really a really kind of like, vibrant discussion. So thank you all. And it has been a very different year. So, and I suppose that lends to it. But if we could move on to item number 10, please, a complaints and compliments annual report. So it seems a long time since we've had this. And can I invite Judith Castillo to introduce herself, please, Judith, for this item.
Judith Castillo, Head of Complaints for Adults and Health.
Oh, thank you very much. So the purpose of this item is to share the 2019-2020 annual report for compliments and complaints with the Scrutiny Board. And this provides information about compliments and complaints received during the 12 months between the 1st of April 2019 and the 31st of March 2020. So obviously that was when we used to have a very different kind of life. And it seems a very long time ago. But so the purpose is to review the operation of the complaints procedure over the 12-month period and provide information about complaint themes, the compliments received, and actions being taken to improve the quality of health and social care services, which obviously has been very... So Judith has joined us for this item. So can I invite either Councillor Charwood or Kath may want to give an initial introduction, or both of you. I don't know how you want to play this.
I have
Oh no, we can hear you.
Sorry. I'll just say a very brief introduction, just to say I'm really pleased to see that we had 100% compliance rate of our complaints that were reviewed by the Ombudsman. That's really good work. It shows our processes are excellent. I mean, we're always going to get people who complained, who perhaps aren't unhappy with the outcome, but when they are then sent to the Ombudsman, that we have 100% rate of our decisions being upheld is excellent. So well done to Judith and the team for that work. We've got excellent performance in acknowledging complaints and resolving complaints, timescales. 98% were acknowledged in the appropriate timescale, and resolving them within 98% were resolved within the time. So that's really great. And I've worked in complaints management in my previous life in a career outside of the council, so that's tough to do. So well done. And I'll let Kath or Judith take over and tell you a bit more about the detail. But proud of this report. Thank you.
Thank you very much.
Okay. Yeah, I'm happy. Yeah, I'm happy to take you through it. So in terms of, sorry, go on, where is that?
Yeah,
Yeah, so as members are aware, the Adults and Health Directorate have the requirement to have a statutory complaints procedure. This requires us to be accessible. It requires that complaints must be acknowledged within 3 working days. It requires that we resolve complaints within times we've agreed with the complainants. And it requires us to ensure that we provide people with information on how they can escalate their complaints to the local government and social care ombudsman. And it requires that, you know, we inform people on how they can provide feedback, good or bad. And as Councillor Charwood has said, when you look at our performance, despite the pressures and the limited resources, it has been a very good year for the Adults and Health Directorate. 98% in terms of complaints that are, you know, resolved within times we've agreed with complainants is an excellent performance, especially when you look at the issues that people must resolve. They're very complex. And you know, to ensure that we are satisfied that people are happy, we send out a satisfaction questionnaire. We ask people after they've received the complaint, their response, whether or not they were satisfied with the response they received. So when we report on 98% performance rate, we have also double checked with the people as to whether or not they're satisfied. And the Ombudsman now publishes its data in terms of how do local authorities comply with any failings. Do they implement, do they learn from, you know, complaints? And the Adults and Health have 100% compliance rate in terms of the Ombudsman being satisfied. They come back and check to ensure that we have done what we should have done. They never used to do this in the past, but now they're very vigilant. So we provide data, we provide information to evidence that we have learned. And this percentage rate in terms of Adults and Health in Leeds was actually 100%. And of the ones that the Ombudsman upheld, in 14% of the cases, I mean, they upheld 7 of the 25 that went to the Ombudsman. And of those, in 2 of those, the Ombudsman already found that Adults and Health had resolved that satisfactorily. Therefore, you know, and that's a 14% in terms of satisfaction rate of cases where the local authority had already, you know, remedied the person. And actually the national average for that is 10%, whereas Adults and Health in Leeds achieved a 14% satisfaction rate on that one. Again, that is excellent. And in terms of training, we provide training to our frontline staff. And prior to COVID, we had trained about 214 members of staff. And the training provided is actually really excellent because there's a correlation between the training we provide to frontline staff and the performance we're seeing in terms of excellent resolution within agreed timescales. And also members will have noted from the report that we received 1,680 compliments. And that's an increase of 49%. And it will be noted that in the compliments, people are actually thanking staff for being kind, for treating people with respect and dignity. And this is absolutely excellent. And other professionals praising staff for effective joint working and how staff have promoted positive working relationships with partners. This is, you know, all absolutely brilliant. And the reablement team being praised for service, for their service, making people more independent and increasing their confidence and generally improving their quality of life, which has aided their recovery. I mean, these are just examples I've picked out. When you look at the main report, across the board, people have provided excellent feedback. And reading some of that feedback, at times actually brought a tear to my eye, because they were absolutely brilliant in terms of what people are saying about, the services. And in terms of complaints, we received 651 complaints. This is an increase of 25%. And again, this is absolutely pleasing, because, our strategy is to encourage more people to talk to us. We want more people, if they're unhappy with our service, to come to members of our staff directly and tell us, because if they don't have that trust and confidence, they will only go to the media. They will tweet about, my experience of services in Leeds, whereas to see the increase is actually very positive, because the strategy is focusing on more people talking to us, as opposed to people suffering in silence. And we continue to work with all our partners, in terms of the voluntary sector, providing them with training so that they understand their role in supporting people who may wish to provide feedback, and similarly the training, making staff at the front line understand their role in, making sure that people who want to provide feedback can provide feedback. And the times when staff are named, staff now understand that I may be named. However, what the person is talking about is, what does the service look like for me? So staff are very comfortable in actually, if they can't resolve the issue, to inform people on how they can escalate it. And in terms of our joint working with our partners, other teams in other complaints teams, the NHS, the voluntary sector, we have a Leeds Citywide Complaints Managers Group, which is chaired by Leeds Health Watch. And this service has been meeting since, group have been meeting since 2014. And we have the best working arrangements in the country. And I can say that because I'm on the regional group and I'm on the national group. Our joint working in Leeds with our partners is absolutely excellent. We've all signed up to providing a no wrong door. And we've also signed up to people not having to provide a number of consent forms. And this is the aim is mainly to look at how can we improve people's experience, patients, service users, when things go wrong. So this group actually works really well together. The next stage in terms of improving our arrangements is to have a system where we share the learning widely. We have good systems in terms of learning in silos. However, we want to build on that, by ensuring that lessons that we learn are shared across the board, because we are finding that to improve, we're never going to improve if adults and health improves. The issues we're talking about involve other systems, and therefore we are working on that to ensure that we learn and share lessons learned widely. In terms of the potential challenges, the complaints that find themselves to the Ombudsman are a potential challenge, because, we have noted that the Ombudsman, CQC, Health Watch England, they work very well together. They share intelligence. And we have noted that actually, if we're, not on top of what's happening, you run the risk, especially for provider services, where you can have an announced inspection based upon the intelligence shared between the Ombudsman and CQC. And we have also noted that the Ombudsman now, despite saying that, they're going to be easy on us slightly in terms of taking into account, for instance, COVID. However, they have upped their ante in terms of issuing more public reports. Unfortunately, so far, fortunately for Leeds, we haven't had a public report since 2011. And even that one actually related to a commission service. So, again, that points to excellent being resolution focused in terms of practice. We have also noted that the Ombudsman is using its statutory powers more, where they're extending the remedy to other affected parties. So, they will extend that remedy to people who didn't even complain. Those are all risks. And, hence the importance of making sure that we strengthen our systems and our arrangements with our commission service providers. And on that one, the Ombudsman is holding commissioners to account for the commission services failings. And in Leeds, I'm happy to say that, we've been one of the first to develop an information sharing protocol with our commission service providers. We ask them to share the compliments, we ask them to share any complaints so that we can be involved from the outset in looking at how should resolution look like. And again, that's, really good. The other challenge we have actually is dealing with customers whose behavior could be construed as unreasonable, people not accepting the outcome. This remains a challenge because it has huge impact on the council's resources. The top issues people have complained about, as members will note from the report, have looked at, people challenging assessment outcomes, especially in relation to the outcome of blue badge assessment. And this is mostly the impact of the new legislation, which now allows hidden disabilities to be taken into consideration as eligibility for a blue badge. We've also had, people being unclear in terms of how does health, social care, and the independent sector dovetail with one another. People still get confused, when their service involves all the other agencies, they're usually unclear in terms of, for instance, if something goes wrong, who do I turn to? And quality of service, staff attitude, they've come up, but often we find that those ones that are unhappy with the outcome will sometimes focus on the quality of service and the conduct of the member of staff. So in a way, those three are linked. With regard to our commission service providers, some of the top issues raised have been around inconsistency in home care delivery, and people having a number of carers. People would rather have a consistent team. So having a number of carers, people tend to be unhappy about that. And also inconsistency in times of visits and numbers of and not staying for the duration of the time, that tends to come up. But often we find that people are satisfied with the carers themselves. It is the back office in terms of the communication with families that tends to let them down. Those are some of the top issues. I'll stop there and leave time for any questions.
Thank you very much. Thank you so much for that, summary and talking us through the report, which is excellent, as Councillor Charwood said. I'd just like to point out that 45 compliments were to the complaint service. So, and I think that's incredible. So, and for the team, like patient, understanding, and kept people updated. So that says a lot when people are actually complimenting the complaints service team. I think that speaks volumes, to be honest. So thank you very much. I'll bring in Councillor Trustwell, please.
Thank you, Chair. Two very quick, brief questions. On page 229, the table relating to the complaints received, the number of complaints received regarding independent sector learning disability supported day services has gone up from 6 to 57. Is there any particular reason for that? And the second is just a request for a little bit more information on how the blue badge legislation has changed in respect of hidden disabilities. What does that actually mean?
Yeah, in terms of hidden disability, people merely have to say, I have a disability, and we need to listen to that one. yeah, it's a hidden disability, as it is said, and that they can evidence that they have a hidden disability by a professional, not necessarily a medical professional, but maybe if they have a counselor involved with them or somebody they work with, as long as somebody can back up that they have a hidden disability, that may be taken into account for a blue badge. However, it is a challenge because so many people are coming up, saying I have a hidden disability and not providing us with the evidence for us to go by to give them that blue badge. That's it. I think that's how the numbers have gone up, because people are not providing us with any evidence that we can use other than telling us that they have a hidden disability.
Yeah.
And the other question, Councillor Traswell, what was the other one, please?
It was the increase in the number of complaints relating to independent sector learning disability support and day services, gone up from 6 to 57, which just seems to be a very steep increase.
Yeah, and with those ones, we've done a lot of training with the independent sector in terms of sharing complaints that they receive in relation to our services with ourselves. They must share them with ourselves. And also, we've been doing a lot of work with the independent sector in understanding that actually the complaints that they get are very important to support their CQC requirements, whether they are good or outstanding, to look at what are people saying about our services. In the past, they view complaints as a bad thing, as opposed to using it as helpful intelligence, which either highlight whether somebody needs a reassessment, or what is it telling us? So we're trying to change the mindset for them to look at complaints as useful intelligence, which should inform either reviewing somebody's care and support plan and or to inform commissioning activities, hence the change. So as they become more comfortable and knowledgeable about how to use that intelligence, they're sharing the information with ourselves. So you could argue that in the future, we're likely to see, and that's what we would welcome, huge increases in people actually talking to us. Yes, it's a complaint, but it's actually just people talking to us and giving us feedback about the service they receive.
It's a really positive way of looking at it, and you're absolutely right. Councillor Truswell, did you want to come back with that?
Yeah, I just wondered why the increase in learning disability seemed to reflect what we've been told, whereas that's not been picked up in other areas of independent care. But yeah, I think I get the message. What I would like to come back on is this issue of hidden disabilities. Can you give us any examples of hidden disabilities that can now be considered, which weren't considered under the old system before the change in legislation?
Sorry, go on.
I think Kath wants to come in.
I could just submit. Well, I can remember some that was from it. So dementia is an obvious one. So people's dementia affects their ability to get out and about, and it may also go alongside physical disabilities. So that's a very obvious one. There were people who were affected by Crohn's disease, who need to get to a loo quickly. People with autism who cannot cope with the chaos of getting on a bus and need to be in a car by themselves. So there was a whole range. So it isn't just that you have a medical label. We need to understand, and how does that affect you? Because one person's dementia affects them one way, one person's autism affects them a different way. So we do ask for supporting medical information that corroborates what the person is telling us about how it affects them. So it isn't, oh, I've got this medical condition, it's the passport to a blue badge. We have to understand its impact on somebody's ability to travel and park.
Yeah.
Thanks, Kath. That's very clear. Thank you.
Thank you very much. Okay, I'm not seeing any other hands up. Can I say a huge thank you to Judith and to Kath and to all officers for this afternoon. I know quite a few have had to leave us because they've got other meetings, silver meetings, etc., vaccine meetings. So, and Councillor Chalmers has to leave us too. But it was just really, it's been a really excellent meeting and a lot discussed and a lot. So, and huge thanks to Judith. Could you pass on to the team and to yourself our huge thanks for all the work that they do in with the compliments and complaints, and we'll look forward to seeing you in a few months' time when it'll be a very different report next year, I should imagine.
Yes, we're keeping an eye on that one.
Thank you very much. If officers and if officers like to leave us now because we're going on to the work schedule, thank you so much for this afternoon. I really appreciate it, and we'll see a lot of you at the next one. Thank you very much.
Thank you.
Thanks. Okay, so Angela, would you like to take us through the work schedule? And I think we're going to be able to end in time to get a cup of tea before the COVID briefing.
Thank you, Chair. So as usual, this report asks the board to consider its work schedule for the remainder of the municipal year. So the latest version of the work schedule is set out in Appendix 1 for members' consideration. In terms of the next meeting, which is scheduled for 9th of February, after liaising with the Chair, arrangements have been made for the board to receive a further update surrounding the impact of the pandemic on the Leeds health and care system, particularly in view of other winter pressures. Linked to this is also an item providing an update on the COVID-19 vaccination programme. Referring back to the previous budget item, the Chair mentioned that further proposals are expected to be brought to February's Executive Board along with the Council's budget report. So once further details of this are made available, should Scrutiny Board members wish to review and provide feedback to the Executive Board on these additional proposals, special arrangements will be put in place in order to facilitate this ahead of the Executive Board's February meeting. So members at this point are asked to consider and agree or make any further suggested amendments to the work schedule at this stage. Thank you, Chair.
Thank you very much. Is there any comments or questions on the work schedule? No? Okay. Well, thank you. It was a very detailed, comprehensive and quite complex meeting this afternoon, as it always is when we come to money and performance and things like that. But I really enjoyed it, actually. It was really dynamic discussion, which we don't often get with our budget and finance meetings. It would, you know, but it was a very dynamic discussion. So I can thank you all very much for this afternoon. And it won't be long till we're meeting again. So as Angela said, on the 9th of February, but it might be that we have to have another meeting the week before to discuss the Executive Board reports and the proposals within that. But we'll keep you updated as with and also John, I'll put in what we talked about in terms of dentistry into the JOSC response to the national consultation. And can we make sure that Angela, that Councillor Lay's comments and that extra detail is put in about Eden Town into that kind of feedback from the scrutiny boards as well on those budget reports. Okay, thank you very much, and I'll see the majority of you at 4 o'clock.
Thank you.
Bye.